and welcome to the YouTube channel Health Q, the place where our mission is to motivate you to look at the brighter side of the health. As usual, I am your host Physiotherapist Meghna Dave, and I am back with another episode on Health Q channel that will give you some information, tips and even some motivation towards your health. And in today's video, I'm going to talk to the people who are suffering from this very frustrating condition called as stroke. Yes guys, right now quarantine period is going on. We all are locked down inside our home, not being able to move, and the time is tough for every one of us. But the people who are suffering from stroke and the people who are caretakers of the stroke patients are the ones who are really facing some difficult times. So in today's video, I'm going to share with you some of the motivational tips that will show you the brighter side of stroke recovery. So without wasting any due time, let's get started. So the tip number one for the stroke patient is, remember this fact: brain is always capable of healing at any age and at any stage. So no matter what, if you are not able to get the optimal therapy or else optimal treatment for your recovery process, that doesn't mean that your recovery will stop at this point. No matter how old is your stroke, how severe is your stroke, there is always a chance of recovery for your brain to happen. So the first tip is, please do not lose hope. Keep faith. You will be getting better every single day. That takes me to the second tip, and that is, patience is the key to success. You must have heard this term, practice makes man perfect, and that applies to you very much. The mantra for exercise is repetition. Make sure to use your time optimally in making sure that you do the repetitions of your exercises on a regular basis. Repetition will make sure that your movements gets better, your spasticity reduces, and you become independent as soon as possible. Moving to the third tip, and that is, consistency is the key to success. If you are practicing but this practice is not consistent, then you might not get the results that you are expecting from your recovery. Hence, make sure to be consistent in your effort that you put in your exercises, in your focus towards getting back to normal, to bring back the movements that are lost or else are impaired. So make sure whatever the exercises that have been suggested for you, you do it on a regular basis. Do not take breaks in middle. Yes, that doesn't mean that you should not listen to your body. Yes, anytime if you feel fatigue, if you feel that you are not feeling good or else not feeling energetic or any other problem arises, take a pause, take a halt. It's okay. But that doesn't mean that you should absolutely stop doing exercises. Remember, it's just at home quarantine. It's a lockdown. But you have tremendous opportunity to work on your body at your home itself. Moving to the fourth point, and that is, do not compare your recovery with other patients. Stroke is a major problem and it's a very variable problem. Every single patient is different depending on what area of brain that has been impacted. Based on that, the symptoms would be seen. Hence, no two stroke patients are similar. So I would highly request you, please do not compare your recovery speed, your ability to move with any of your known person who has gone through stroke or is suffering from stroke. Please focus only on yourself, only on your recovery, and only listen to your doctors and your healthcare professionals. Moving to the next point, and that is, focus on using all the muscles. Many times I've seen patients who are suffering from stroke, when they do exercise, they only focus on the affected side. Remember, whenever you are going through stroke rehabilitation, or else whenever you are trying to get back to normal or else bring back your normal movement pattern, your normal side of the body is going to be your supportive system. Hence, it has to be strong. Hence, whenever you are doing exercise, make sure that you give equal importance, equal weightage to both sides of your your body. Just do not focus only on one side of your body, that's the affected side. Always work on both sides of body. That will give you much better results. Moving to the next point, and that is, don't think medicines as a way to rehabilitation or else recovery. Botox therapy or else some antispastic drugs might help you temporarily to reduce your spasticity, but exercises are the permanent fix for your spasticity reduction, your rehabilitation, and your potential to get back to the normal. I've seen many patients in my practice who rely more on medicines over to the exercises. Remember, medicines are important to keep your vitals under normal, but exercises are important to bring you back to normal. Tip number 7 is get adequate sleep. Sleep is one of the major factors that helps you to get back that energy that you will burn while exercising. Hence, make sure that you get adequate sleep. If you are finding any difficulty in sleeping, make sure to take some professional help and first work towards reducing your insomnia or any other sleep disorders. Moving to the next step, and that is, whenever your results are slowing down, don't think that now you will not recover further. Yes, after 3 months of stroke recovery, there are chances that you will touch that plateau phase where the recovery might get little slower, but that doesn't mean that you will not recover at all. This is the indication that you need to work out now more. Your body has adapted to the exercises that you were doing till now. You need to push yourself more to do more exercises in order to gain better strength. Tip number 9, do exercise, but do not overdo exercise. Many a times overdoing exercises leads to muscle injuries, which are potential source of pain and other musculoskeletal secondary disorders, which is something that you should absolutely avoid to develop. Hence, whenever doing exercise, make sure you listen to your body. Tip number 10. I know stroke is a long-term problem. You won't get better immediately, and sometimes it makes you think that whether you will be fine someday or not. Please, at this point, I would like to give you a tip. Visualize and think, or else imagine yourself living in the days where you are absolutely normal. Visualize your future and make sure to believe in that future, because whenever you will believe in your future that you want for yourself, that would be the time when you will get motivated to put that effort within yourself to get back or else reach your goal of being absolutely independent. So here visualization is the key, and make sure that you visualize that state of being completely independent and completely healthy. That takes me to the last step of this video, and that is become your own stroke recovery expert. Just do not rely only on your therapist, only on your caregiver in the family, or else only on your doctor. You are your biggest expert. You know your body best. Nobody in this world knows your body, your potential abilities, and your strength as you know it. Hence, always remember to use your strengths, your confidence, and put that confidence in your strength and make yourself the biggest expert for your body. How you can do that? First, talking to your healthcare professional. Second, educating yourself about your problem and learning logically what is supposed to be done. Third thing is believe in yourself. You are very much capable and have a tremendous potential to fulfill your goals and to get back to that independent state of life. So, getting depressed or else getting sad is not going to help you. Rather than that, believe in yourself, and becoming your own expert is something that you should do. But that doesn't mean that you just neglect the advices that has been given by your healthcare professional. What I'm trying to tell you here is to collaborate with your healthcare professionals, collaborate with your caregivers, your family members in planning out your therapy regime. Whatever are your feelings, whatever that makes you feel strong, makes you feel good, whatever are your feedbacks with performing exercises, share that on a regular basis with your therapist and help your therapist in letting them know what are your possibilities, what is working for you and what is not. This information will help your therapist or else your healthcare professional in designing your treatment program. And that's how this entire team approach will work in your favor in your recovery process. Remember guys, this is a battle, although it's a long one, but in this, if you put your effort, success is going to come in your way. No matter how old is your stroke, whether it happened 2 years back, whether it happened 2 months back, 2 weeks back, or even 20 years back, there are always the chance of getting recovered or else getting better from what you were earlier. All you need to do is first believe in yourself. Second, visualize yourself as being completely independent. Keep this visualization in your mind while you perform your day-to-day exercises. Third, do not get overwhelmed by exercises and do not get depressed by the plateau or a slow recovery. Believe that one day will come when you would be fine, and that day will always come for sure if you put your efforts 100%. So on that note, I will end this video here. See you in another video. Thank you.